So you're big on sedation in your practice.
Yes.
Who's a candidate?
Really, anybody is a candidate for it. We of course want to make sure that the patient's healthy, to be able to undergo sedation, and so that we are doing it safely. We may need to consult physicians just to be, be sure that we are doing a good service for the patient. But really, just about anybody is a candidate. And they generally fall into two types of patients. One is the high fear patient that they can't stand the thought of coming in to see the dentist. They don't even want to come in for an exam for us to look at their teeth, much less have treatment done. And so they come in and we can sedate them. The great thing is with sedation, and we can do it a few different ways. We can do it in pill form or we can do it in IV. And so the vast majority of our sedations now are done with IV. And both Dr. Jackson and I have had extensive training for IV sedation, full permits and things, and licenses. And so they come in, we do IV sedation, and they can get years of work that's needed to be done in that one visit.
So like if a woman has like 4 children, she doesn't have time to go back and forth.
Yes, so
she could do like a lot of stuff.
Exactly.
In one visit.
And that's the other type of patient. So it's not all fear patients. So someone may have no dental fear coming in, but they are limited on time. They don't have time to come to the dentist 4 or 5 visits and have a lot of work done. So we can do sedation on those patients as well, get them wrapped up in one day and get all their treatment done under sedation, and then they can go and they can be with the kids and they can return to work and their normal duties without having those multiple visits where they're coming in.
Now, is it true with these IV sedation, they have very little memory of the procedure?
Very little memory.
Like amnesia almost.
Yes. These sedation drugs cause amnesia. And so, what keeps patients away many times is a fear from when is a memory of a bad experience when they were a kid. So even just the memory of getting work done on them may keep them out of the dental office, may keep them out of the dental chair, and they're putting off issues, and they become pain issues and infection issues. So we don't have to to do that anymore. They don't have to put it off anymore. They can come in, we can sedate the patient, we can get a lot of work done, and hopefully avoid many future issues.
Have the smile they've always wanted.
And have the smile they always wanted, get it done under sedation, and they're great, and they're good to go, and they don't remember it, and they don't have to worry about the fear that would come during the procedure without being sedated.